wrist flexor muscles. The wrist flexor muscle group is found along the inside or anterior aspect of the forearm. The two muscles that make up this group are the flexor carpi radialis and the flexor carpi ulnaris. This muscle group functions in grasping movements of the hand. Now we'll take a look at the landmarks for the wrist flexors. We have the humerus, the ulna, the radius, and the carpal bones. The flexor carpi radialis originates on the medial epicondyle of the humerus and inserts on the second metacarpal bone. The flexor carpi ulnaris originates along the posterior aspect of the ulna and near the olecranon process, and inserts on the pisiform bone. Contraction of the wrist flexors together produces wrist and hand flexion. Acting alone, the flexor carpi ulnaris and the flexor carpi radialis can produce wrist adduction and abduction respectively. The hand and finger flexors assist the wrist flexors during wrist and hand flexion, and the wrist extensors oppose the wrist flexors during wrist and hand flexion. Symptoms associated with trigger points in the wrist flexors include pain on the anterior aspect of the wrist, difficulty using scissors as opposed to forearm extensors involvement, and possible entrapment of the ulnar or median nerves, which causes numbness, tingling, and weakness in the hand and the wrist. Activating and perpetuating factors for trigger points in the wrist flexors include prolonged tight grip on something such as a steering wheel or a hammer, and pulling weeds. Referred pain from trigger points in the pectoralis minor, latissimus dorsi, and serratus posterior superior can activate trigger points in the wrist flexors. Trigger points in the pronator teres muscle are also associated with the wrist flexor trigger points. Common misdiagnoses for active trigger points in the wrist flexors include medial epicondylitis, ulnar neuropathy, carpal tunnel syndrome, thoracic outlet syndrome, and C5, C7, and C8 to T1 radiculopathy.